Hello and welcome to this week's staff brief. I'm Paul Robinson, I'm the Chief Executive here at Sherwood, and with me today I have Donna Mariner, our Associate Director of People, who will be updating us on the Developing You Pillar programme. Just before I hand over to Donna, just a few general updates. I'm really pleased that last week we were awarded the Carer Friendly Employer Quality Mark. That's awarded by the Nottinghamshire Carers Association. And this is in recognition of all the work that we've done around identifying, acknowledging and in supporting our colleagues who may be caring for someone. Huge thank you to all those that for their hard work in making this happen. And if anyone is a carer and looking for some support, you can email the wellbeing team, and I'm hoping that in the background where Jess Baxter, part of the communications team, is giving us our technical support today, then we can get the wellbeing team email address out there. So if you're a carer and you want some help signposting, please email the wellbeing team, and congratulations to all those that made the quality mark a reality. So thank you for that. Talking of things being awarded, our Excellence Awards. Thank you to all those who submitted nominations for this year's Excellence Awards. Nominations are all being sifted through and we're looked at by selected judging panels. So that process is ongoing, so keep your eyes peeled for more details coming soon in the bulletins. Lastly, as an update today, I'm pleased that we're able to start again our governor events. Our Meet Your Governor Again events will be happening this week. There are events at both Newark and Kingsmill sites. Really good opportunity for you to talk to governors, understand their role, understand how they can help and support you, and understand how they can champion excellent patient care. So at Kingsmill, the events will be on Wednesday, that's tomorrow, and also on Friday. They are held in the KTC opposite Clinic 3, and on Wednesday it will be at 3 o'clock until 5 o'clock in the afternoon, and on Friday it's at 9 o'clock in the morning until 1 o'clock at lunchtime. There are 3 events this week at Newark Hospital. That's Wednesday, Thursday and Friday, all at the same time. That's 11 o'clock in the morning until 1 at lunchtime, and they're in the outpatients area at Newark. So please get involved, please pop along if you're able to. Okay, so that's the general updates for today. Just encourage you to use the Q&A, the chat, if you have any questions for me just generally, or indeed for Donna on the just lost my notes there, on the Developing You pillar, Donna. So over to you. Sorry about that.
Thanks, Paul. Thank you for inviting me along to talk about our Developing You pillar. So the Developing You pillar forms part of the people and culture strategy, and what we've done is we've really taken notice of the staff feedback comments that come through, and whilst you tell us what a great organisation we are, which is fabulous, you also give us some really good valuable feedback on where we can improve. And what we've done is we've taken and put these into 3 recurring themes which we've put under the Developing You pillar. And I'd like to talk to you about those today and just give you a little bit of an update as to where we are as an organisation and what we're doing to try and improve those for all of you. So the first one I want to talk about is, you told us that you felt there was inequity and a lack of transparency around development opportunities across the organisation. So in response to that and looking at how we can address that, we are reviewing our recruitment matrix, which, and for those that are not recruiting managers or are not necessarily aware of that, it's a document which provides managers with guidance on how to recruit for certain roles. So whether it be a 3 months secondment, a full-time permanent job, and additional hours, there's some guidance from a trust perspective in there. And we do review that every 12 months just to make sure it's fit for purpose, because we do totally accept that, you know, the landscape changes and the requirements from the organisation change. So we are reviewing that again, and that'll go through the people and resourcing group, which has got a real good mix of colleagues on there to provide information on there. We do have some very clear guidance and training around recruitment. Again, that is reviewed annually to ensure that it is fit for purpose. But what we've recognised is that we probably need to do a little bit more focus on targeted training and refresher training, because again, we totally accept that our recruiting managers change and we have new people into the organisation. So we are signposting all our recruiting managers as to where they can find that information. So there's some real good work around how and when we can provide you with the guidance and the updates of that. The second one is that you told us that although we undertake appraisals and our data supports that, we have a very high percentage of completed appraisals, what actually happens in there doesn't necessarily add much value to us as individuals. So what we have done from that perspective is we have set up a working group to review our appraisal process, just to ensure that our colleagues can feel valued and can get a real output out of an appraisal. And what we'd really encourage you to do is to let us know what you feel a good appraisal looks like and what you would like to see that look into. I'm sure we can share the working group information in the chat if anyone does want to contact us to look at that, Paul. That's okay. And then the third one that I want to talk about is, and we've seen our organisation grow, so I totally accept this, is that you felt that there wasn't enough people within the organisation to do your job comfortably and properly. So our organisation has grown from 4,000 to 5,500 in the last couple of years. A lot of that is due to COVID, but I think a lot of that is due to our activity and capacity and the locality, community, etc. So what we're having a real push on is recruitment and inviting people to come and work for what we know is a fantastic organisation. So to do that, we are working with our system partners to do some system recruitment to really maximise the benefits and the effects of that. We have developed an internal microsite, which we have launched for nursing predominantly, but we will be expanding it to other staff groups. And what that provides is a real modern platform and a visual platform to encourage people to come and work for us. We've got lots of staff videos on there so people can see what it's like to work in departments, what job roles are like, and we will be expanding that further. We're reviewing our advert content because we know we've got a hell of a lot of competition out there from a recruitment point of view at the moment. We've got the likes of Amazon that, you know, we know pay a little bit more than we do, and their adverts are quite cheeky and they grab people's eye. So we're doing some internal work, just looking at making sure our wording is attractive and encouraging people to come and work for us. We're really focusing on people that are new to care. So we're offering the safe care, the care certificate training for anyone that's new to healthcare support worker. So we're encouraging people to come and work for us that have not necessarily worked in care before. We're working very closely with Care for Knots, which again is a system-wide programme, but Hannah Parapane leads that from an SFH point of view. We are actively working with our local colleges to try and entice, you know, college leavers and people that probably wouldn't think about the NHS as an organisation, as a career. I think sometimes we think that the NHS is just doctors and nurses when we've got a myriad of opportunities for people, and they don't necessarily need experience. You know, we're willing to develop people. And we have apprenticeship schemes. We're looking at international nurses still. We've recruited over 120 international nurses to come into our organisation, proven very fruitful. Recently we've had the junior doctor intake, our highest ever numbers in August. I think it was just over 200. We are also looking at an admin transformation programme, which is being led by Robson Cox and Joe Wright. Again, looking at how can we really impact and grow our admin workforce and encourage people to come and work for us. Because historically we have seen that nursing areas are the ones that are challenging to recruit to, but we have seen that that extends to admin programmes at the moment. And we're just trying to sell ourselves for the great organisation that we are. Open and welcome anyone that wants to come and join any of these groups that we have, and I'll share those on the chat as well, Paul. But open to questions if anyone would like to talk or anything.
Thanks, Donna. And I think what I'm interested in there is explore a few things, if I may. That those three things are in the same pillar because they're obviously interlinked, aren't they? So I think at the heart of it, we need to encourage people to work for us. as that's the last point you were making, and encourage people to stay with us. And that's the first two things, isn't it? People being able to see that there's a transparency and an equity around recruitment of their own colleagues, but also that therefore that, and then the appraisals that add value bit for me is about feeling supported in their role.
Absolutely. Yeah, it isn't just about attracting people to us. To get those numbers up, we need to make sure that we retain the good people and we develop people, and that's a real focus from a people and culture strategy.
And so it's really important that we, you know, that they were messages from the National Staff Survey, but because they're so interlinked and mean the same thing for me, you know, get the right people into the roles, encouraging people to join us and encouraging people to stay because it's a good experience here at Sherwood. So we've got a question. It's not directly associated with this, but I'm hoping Donna, you can help. So it's an anonymous question: why have we allowed minimum wage to catch up with band 2, which shortly will be the same as band 3? I have to say I'm not quite sure of the pay grades to that level of detail, but so the minimum wage continues to be reviewed nationally, and obviously that increases, and so it's caught up with band 2. And then band 2, and I think in the pay award perhaps is where the individual who put this in the chat is thinking that then the differential between band 2 and band 3 is reducing. Would that be right?
Yeah, I think so. And I think it's what's really important to just remember is that the pay award proposal that was put forward, the government approved, and that's what's coming into play. But I'm sure there'll be further negotiations or conversations on that.
Thank you. And this is about encouraging people to join, and I think it's a comment. So we also have the Health Ambassador Network for staff members who are interested in attending events and engagement sessions with schools, colleges and the local community to promote careers in healthcare and to shine a light on the NHS careers that aren't well known. If anyone is interested in joining this group, please contact Learning and Development. And just on that note, I've just had a meeting with Edward Peck and Andrew Cropley, who are the leads for West Notts College and Nottingham Trent University, and we've been discussing and sharing our ambition to improve the offer for local people in Mansfield and Ashfield and Newark and Sherwood to access educational opportunities and to access careers in the NHS with Sherwood Forest. So we'll be doing a lot more thinking around what that actually means, what it looks like. But certainly West Notts College and Nottingham Trent University are looking at expanding their offer to local people at their sites, their adjoining sites here in Mansfield. So a couple more questions. With us now being part of the ICS and therefore working with partners across Nottinghamshire, whilst there will be local competition between partners, is there any plans to have a strategy to focus on recruitment system-wide and the opportunity to recruit from out of area?
There is, Paul, and I'm leading on the people and resourcing group from a system perspective, and that is currently in development at the moment. Happy to come back another time and talk about that. Yeah,
that'd be great. Yeah. And another comment: how and who decides who the good people are to be supported and promoted? Well, I think that's a question and an answer that individual managers can have with individuals who are looking to develop their opportunities here at Sherwood, and that's part of the appraisal conversation that I fear isn't taking place when we get the feedback around that the appraisals don't add value. Understanding who and how and who wants to develop, how they want to develop, and how they want to develop their career here at Sherwood is part of that really important conversation that doesn't have to happen annually in an appraisal, but can happen at any touch points with managers across in the year. And there are frameworks that we've got around understanding talent, understanding development opportunities, and building personal development plans that Donna no doubt can talk around, but and point us to. Is there anything that you can add to this, Donna?
I think I would actively encourage us as individuals to take a lead on that. That if we want to develop, that we take control of those conversations. We are in control of our own destiny. So if there are colleagues out there that do want to develop, have those conversations. And there's lots of information on the internet around lots of different training.
Thank you. So there's a comment here around Vision West Knots are currently piloting administrative industry placements with 350 hours of work placement as part of T-level courses. So it's about 45 days commitment there, and this can be 1 day a week or as a block placement, and it acts as a recruitment screening process so you can develop an insight into potential employees. If you're interested in offering an administrative work programme for T-level students, please contact Louise Storey, and I'm just publishing that email address for Louise. So if anyone's interested in that offer, please contact Louise. A couple more questions, but I'll leave those until we've concluded with Donna, really. So so Donna, how can we see what you've described moving forward? I'm thinking, how are we measuring the impact? Number of new recruits, for example, or opportunities to join Sherwood, but can be something that we can measure. How about appraisals that add value? What's the sort? How are we thinking that we move forward on understanding whether we are adding value in those appraisals?
I think that's a really important question, Paul. And whilst I said earlier, from a data perspective, it's evidence that we are undertaking those appraisals. The quality obviously isn't there, or what we want to happen from that. So that can only come from feedback and seeing people developed. We are able to show statistics on people developing with the organisations. So, for example, we see people move from band 5 to band 6, and we're able to track that. And I think that's one thing that really shows it if we are developing our people, that we've done that correctly. But again, the staff survey, that would be really useful for us. You know, please let us know if there is anything else that we can do to support. Get in contact with your managers, get in contact with myself, get in contact with Vicky, Malia, if there's anything that you think we can take forward. But keep talking to us. We actively encourage you to come and have some conversations and provide us with that feedback.
Thank you, Donna. And there's a comment here from Michelle Jackson, and I think this is something I think needs to be part of the thinking in the admin transformation group. So Michelle's saying the band 2 role is varied. I do think this does need looking at. I am a ward admin support at a band 2, and we do a lot of work for ward leaders and matrons, which is basically as a PA role, and I don't think it merits a band 2 when jobs go out and job descriptions are similar. And there's some feeling a bit that being definitely unfair, and no one's listening, and that we need to look at job roles sort of holistically. And we've waited for 1 year to recruit, and now this person left after a month. So I think there's something there. I mean, you might want to, Donna, you might want to explore with Michelle the specifics of some more of the specifics and details of that. But there's something about ensuring that we've got job roles that we reflect appropriately the level that people are working at, and we do that in terms of salary, but also their development needs, and think about you know, the admin and indeed all our job roles in the future, and making sure that we attract the right people and the right people stay with us. And it's back to those two touch points for the whole thing, for the whole pillar of developing you, I think. Is there anything that you want to comment on there?
Yeah, thank you, Paul. I think it is really important that we listen to people like Michelle, and I'm happy to catch up with you outside of this, because as we said earlier, if we are recruiting new people in, what we really need to make sure is that our existing colleagues are really feel valued and looked after. Through the admin transformation programme, there is some work looking at job descriptions. What's really important to remember is our job descriptions are based around national job evaluation criteria. So when we evaluate a JD, it is set. However, what we do tend to see is things slip over time, so there can be a little bit of a change in wording. So we are looking at how we can address that moving forward, just to make sure that we've got the right JD applied to the right role.
Thank you. There's a rather specific question about vaccination hubs. Are we still looking for vaccinators for there, do you know?
We are just reviewing what the potential update is going to be for phase 5, in line with what the actual vaccinators that we've got. We should know more by the end of next week, and if we are, there will be an advert going out.
Okay, great. So we're looking at the plans. We just received all the guidance. I'm aware of that in terms of what we've been asked to do.
Yes.
Across that next phase in the autumn. So if there's any opportunities there, then we'll communicate those as soon as we're able to. Great. Michelle's come back and said that she'd love to have a chat with you, Donna. So if you could pick that up, that'd be absolutely brilliant. Thank you.
No problem.
And then I've got one last question, which is a sort of a general question about any update on mandatory mask wearing. We keep it under weekly and constant review. The incident control team that we put in place through the whole of the pandemic is still meeting each week. It meets on a less frequent basis than it did previously, but it meets every week, and that is something that we're keeping under review. I think it's really important that whilst we're on site, we ensure that we're protecting our teams, our colleagues, and our patients. You know, at the moment we've had since we reinstated mask wearing, we've had a low number of outbreaks. Both staff and patient outbreaks have been lowered as a result. So at the moment, we think it's the right policy to pursue, and we'll keep it under review. Okay, can't see any other questions. So I will wrap up there. Thank you, Donna. That was really insightful. Apologies for forgetting the name of the pillar as I just turned to it. That was unforgivable, but I'll seek as much forgiveness as you're able to give me. And really interesting to understand how we're working to encourage people to join us and encouraging people to stay through those pieces of work. Thanks for everyone who took part in the engagement there in the chat, asking questions and also providing a little bit more detail and helping us with some of the answers. So thank you for that. Thanks to Jess in the background today. And I'll sign off there. Hope everyone has a good week. For those who are able to join with loved ones, friends and family over the bank holiday, I hope you have a good bank holiday. And I'll see you again next Tuesday at 12 o'clock, which is our new time and place for the staff briefs. Okay, until then, have a good week and very best wishes. Goodbye.